When large scaly skin falls on our shoulder, when scaly skin flakes of the skin are seen on the hair, the person becomes very much depressed or gets disturbed. This type of conditions usually reduce the self-esteem of the patient and thereby they affect the work efficiency of that individual. One such condition is scalp psoriasis. In Ayurveda, we have several ways or options to treat scalp psoriasis like Shodhana, Shirodhara along with specific dosha specific kind of line of treatment. But in this video, we are going to discuss an entirely new approach to treat the scalp psoriasis. Friends, if you want to treat scalp psoriasis effectively, then watch this video completely. Namaste friends, myself Dr. Mahesh Savalagimath. I am practicing Ayurveda dermatology and teaching Ayurveda since 13 years. Welcome to my channel, Dr. Mahesh speaking. Friends, scalp psoriasis is one of the most disturbing skin conditions because in this the patients will be having visible scales which are visible to others, like they fall on the shoulders, they become visible on the hair and all, and it is usually seen as a commonest clinical condition in the category of psoriasis. As per the modern dermatology, it is very difficult to manage and also prevent the recurrence because it has got highest recurrence. In this video, we are not going to discuss in detail about the disease scalp psoriasis specific, but in this video we will discuss how we can treat scalp psoriasis with the example of two patients. Two scalp psoriasis patients which were diagnosed as scalp psoriasis by modern dermatologists, and both were treated by the conventional modern medicine, but there was no successful outcome. So then they approached us, and how we treated that patient, that we are going to discuss in this video. Let us see the first case. You can see the lesions are there, circular scaly lesions. Scalp psoriasis can be seen as acquiring whole of the scalp, or the lesions can be scattered here and there on the scalp. In this patient, you can see there is scaling, well defined, demarcation is there, scales are there, skin is dry, and this patient is having occasional itching. Let us see the second case. The second case, here you can see again the scattered lesions are there, but compared to the previous case, in this scales are comparatively thicker and scaling is there. Okay, this patient was having constant mild itching. Okay, these two patients were diagnosed as scalp psoriasis. In one of my previous video, I have explained the principle of Three Sutra Ayurveda, its utilization, its application in the management of skin diseases. So if you want to watch that video, you can watch that video by clicking the link shown in I button. So in these two patients, we used one of those principles of Three Sutra, that is Hetu, etiology. Friends, when it comes to etiology, we need to understand it under two headings. One is the etiology that sets in a particular pathology, and a pathology or a pre-existing pathology that acts as an etiology for another disease, like autoimmunity. Autoimmunity caused by some other reasons, by some other etiology, and thereby autoimmunity becomes a cause for some other diseases. So psoriasis in general, irrespective of its type, all the kinds of psoriasis are considered as diseases caused as a result of altered immunity or autoimmunity. So in these two patients, we considered the pathology, that is autoimmunity, not bothered about dosha, presentations and all, much importance was not given, but we considered the etiology as autoimmunity, and we treated both the patients with Krimighna therapy. Friends, if you are interested in Ayurveda dermatology, if you want to improve your knowledge of Ayurveda dermatology, and if you want to get any more information about that one, I have videos on psoriasis, Ayurvedic understanding, psoriasis, Ayurvedic management principles, palmoplantar psoriasis and Ayurveda, eczema and Ayurvedic understanding, eczema and Ayurvedic management, contact dermatitis and Ayurveda, allergic footwear dermatitis, its Ayurvedic management, application of Three Sutra principles in the management of skin diseases, and effective selection of Kashaya yogas in the management of skin diseases. If you are interested to learn more about Ayurveda dermatology, you can watch all these videos going into my channel. Now coming back to these two cases, what treatment we gave? We gave the Krimighna therapy. So we gave the patient Haridra Churna, Vidanga Churna, Amlaki Churna and Trifla Churna. This combination with varying quantity, like in some Haridra was less, Vidanga was more, like that. Sometimes we need to do that one as per the patient. We changed that one, and this was given twice daily, 1 teaspoon around 3 to 5 grams per day, twice daily after food, followed by jaggery. And externally we gave Kutaja Taila. It is a Banupaki Taila. Okay, it is the Kutaja Taila is prepared using coconut oil and Wrightia tinctorial leaves, and it is subjected for Banupaka, that is exposed to sun heat and solar heat, and by that the oil is prepared. So we gave this treatment, and in span of 21 days or 22 days in this patient, another patient it was around 27 days. You can see the lesions are completely reduced. Lesions are completely reduced. There are no any scaly lesions. The other patient, the second patient also you can see. The friends, very important thing is, this has been almost 3 years that we have treated these two patients, and till now these two patients have never developed any scaly lesions on the skin. You are getting what I am telling? So why it happened? Maybe because we were targeting the internal cause, actual cause, not the external exogenous food and all. We were targeting the internal cause that set in the psoriatic pathology. Okay, so we treated for that. So that may be the one of the reason that we were able to prevent the recurrence of scalp psoriasis at least for now 3 years. So now you may be getting question, why Krimighna drugs were used. So friends, autoimmunity is like disturbed immunity, means where the immune system fails to recognize self and non-self, means what is good for our body and what is bad for our body, that our immunity fails to recognize, and it attacks, it treats our cells itself as invading agents, and it attacks them and causes several diseases, and psoriasis is one clinical manifestation as a result of autoimmunity. So as per Ayurveda, Krimighna means something which enhances Krimighnatva of our body. It's not like pharmacological action like Krimighna drugs when we give, they have antimicrobial effect. No, it's not like that. Our Krimighna drugs will never, usually will not have that kind of direct attack on microbes and attack and kill them, antimicrobial kind of effect. Rather, our Krimighna drugs act on our body and enhance our Krimighnatva. Krimighnatva means it's a one part of our immunity. So they enhance body's ability to recognize and act against invading agent, which is hampered as a result of autoimmunity. So we targeted that, we treated the patients with the Krimighna drugs, and we were successful. So what is the ultimate take home message? Krimighna therapy serves as an important option. You can make it as addition to existing your line of treatment, or you can treat such scalp psoriasis patients just by Krimighna therapy. And we commonly use to prevent the recurrence. When the clinical presentation subside, at that time, to prevent the recurrence, we usually use these type of Krimighna therapies in psoriasis patients. That's it friends. If you feel this video is useful and it is adding anything to your existing knowledge, please like the video and also share with all your friends and all budding Ayurveda doctors. If you have any queries and suggestions, please write in the comment section. Also your opinions about this video in the comments. Thank you for watching the video. Take care. Keep learning. See you in next video. Thank you. Namaste.